Nutrition in diseases of the nervous system. Diseases of the nervous system are among the diseases that affect human life to a large extent and can negatively affect the life of the individual who needs attention. The nervous system is a system consisting of the brain, cerebellum, spinal cord, cranial nerves, and peripheral nerves. All diseases affecting these areas are called diseases of the nervous system. Nutrition in diseases of the nervous system is an important component of disease treatment. What is the nervous system? The nervous system, also called a neural network, is a vital organ of organs. It is a system that enables living organisms to perceive their internal and external environment, obtain information, and analyze, evaluate and process the information they have obtained. It is responsible for transmitting the signals generated by the network of cells in the body to different parts of the body. It is an active system that shapes and regulates the activities of organs and muscles. There are two different nervous systems, the central nervous system, CNS, and the peripheral nervous system, CNS. Central nervous system. The peripheral nervous system of the brain and spinal cord is a system that surrounds the whole body and provides the connection of the central nervous system, i.e. the brain and spinal cord, to the whole body. The peripheral nervous system consists of motor neurons, which are the basis for voluntary movements. It is a nervous system consisting of the autonomic nervous system, parasympathetic nervous system, regular involuntary movements, and the enteric nervous system. Even a minor accident to the nervous system or even a minor injury to the nervous system can lead to important and lasting situations that can cause the whole body to malfunction. What are diseases of the nervous system? Diseases related to the nervous system are diseases that can cause serious and permanent effects as a result of damage to related organs due to damage to organs affecting the central or peripheral systems. There are many diseases related to the central nervous system and the peripheral nervous system. Paralysis is a disease that occurs when the blood circulation in the brain continues less than it should, or because there is no blood circulation, the nervous system and muscles do not work properly, and the nerves that enable movement are damaged and cannot function. Epilepsy, a disease in which seizures occur in the form of seizures as a result of loss of consciousness as a result of damage to nerve cells in the brain and the inability to fully perform their duties. Mental illness, it is a disease of the nervous system that is incompatible with human thoughts or behaviors that are considered normal, and occurs as a result of disturbances in these basic functions. Parkinson's disease, it is a disease of the nervous system in which involuntary trembling movements occur due to the inability of nerve cells in the brain to perform their duties as they should. Meningitis, it is a disease of the nervous system as a result of inflammation of the membrane covering the brain and spinal cord. Tongue paralysis, it is a disease of the nervous system that results in the tongue being unable to function as a result of damage or injury to the nervous system. Anosmia, it is a disease of the nervous system in which the sense of smell and smell does not function due to damage to the olfactory nerves. It can occur in cases of illness such as a cold or the flu. Aphonia, it occurs due to injury or damage to the nerves that control the muscles that serve the function of speech. Loss of voice can also be called diseases of the throat or larynx. The ability to speak disappears. Nervous dyspepsia, it is a disease that affects the nervous system as a result of the inability of the nervous system to work in harmony in the responsible departments, and the nervous system losing its regularity when performing its functions. Nervous dyspepsia may occur due to reasons such as drinking tea or coffee, excessive alcohol consumption, unbalanced diet, eating junk food or inability to adjust the speed of eating, taking large bites, and swallowing food without adequate chewing. Polio, caused by bacteria. Polio is a disease of the nervous system that causes spinal cord muscles to contract and nerve cells to be damaged or destroyed. The disease-causing bacteria are spread through feces. Oral medications are used to treat polio. How should nutrition be in diseases of the nervous system? Nervous system diseases are caused by injury or damage to the peripheral nervous system or its center. Nutrition in diseases of the nervous system is important in the treatment of disease. A balanced and regular diet is one of the most important factors for brain development. 1/3 of the nervous system, the formation and development of which begins in the womb, develops in the womb, and the rest develop in the first years after birth. The mother's consumption of amino acids, proteins, fats and vitamins during pregnancy affects the baby's brain development. In other words, nutrition is very effective in the development of the nervous system. Especially for the development of nerve cells, B vitamins, electrolytes and fatty substances are needed. The energy needed and required for the functioning of the brain is also obtained through nutrition. As a result of this situation, it can lead to such states as disturbed mood, forgetfulness, slowing down or regression in the development of intelligence, and slowing down of the thinking system. Iodine and iron deficiency during and before pregnancy, folic acid deficiency and congenital metabolic problems cause disturbances in the development of the brain and nervous system. For the central nervous system to function regularly and carry out its duties, it provides uninterrupted glucose to maintain regular blood sugar. A continuous supply of glucose increases the cognitive functioning of the brain. The keto diet is applied in cases of epilepsy, a disease of the nervous system. This diet is high in fat, low in carbohydrates and contains protein as needed, and is used to treat seizures and uncontrollable seizures such as epilepsy. It aims to reduce the number of seizures and the severity of seizures. Fruits and vegetables are allowed. Increased consumption of mayonnaise rich in butter, oil and fat. The keto diet is applied in cases of epilepsy, a disease of the nervous system. This diet is high in fat, low in carbohydrates and contains protein as needed, and is used to treat seizures and uncontrollable seizures such as epilepsy. It aims to reduce the number of seizures and the severity of seizures. Fruits and vegetables are allowed. Increased consumption of mayonnaise rich in butter, oil and fat. When examining neuritis and neuritis caused by injuries or tumors of the nerves, it is found that most of them are caused by a lack of vitamin B. In the treatment of pollen neuritis and pollen uritis, a diet rich in B vitamins is followed. The consumption of salt in nutrition is controlled for diseases of the brain and blood vessels, which are the most important diseases of the central nervous system, which are often caused by atherosclerosis and hypertension. If there is a case of being overweight, the goal is to reach the ideal weight. Try to reduce the use of saturated fats. The use of potassium metal is kept at a certain level. Foods that are considered antioxidants are increased. Certain food groups and foods consumed in studies on migraine have been shown to cause the disease. As a result of studies conducted on Alzheimer's disease, it was concluded that vitamin B deficiency, especially vitamin B6 deficiency, folic acid deficiency or deficiency of the element manganese with the symbol Mn has a significant effect. In addition to the consumption of these elements and vitamins in connection with the diet for this disease, vitamin C, abundant consumption of fruits and vegetables, and balanced salt consumption also contribute to the treatment. In addition, omega-3 support and fish oil are applied in the diet for Alzheimer's disease.